exercise, and the condition I'm going to be focusing on in this presentation is narcolepsy. So narcolepsy is a condition where people experience excessive daytime sleepiness. People with narcolepsy often find it difficult to stay awake for long periods of time, regardless of the circumstance. This disorder affects the brain's ability to control its own sleep-wake cycles and can often lead to sleep attacks. When talking about narcolepsy, it is important to recognize that narcolepsy is categorized into two types, type 1 and type 2. So type 1 narcolepsy is generally termed with cataplexy, which is the sudden loss of voluntary muscle. Type 1 is also connected with having low levels of hypocretin. Type 2, which is the second type of narcolepsy, is usually a result of an injury to the hypothalamus. In this case, with type 2 narcolepsy, other neurological issues may be present. Okay, so this photo just outlines some common symptoms that narcolepsy patients may experience. These include but are not limited to excessive daytime sleepiness, bouts of muscle weakness, also known as cataplexy, hallucinations, and sleep paralysis. If a person is experiencing these symptoms or is suspected of having narcolepsy, then a multiple sleep latency test or a polysomnography may take place. Okay. So the causes of narcolepsy do vary case to case. However, narcolepsy has also been connected to a certain gene mutation that causes low levels of hypocretin. Hypocretin is essential for alertness and wakefulness, so it makes sense that if there's low levels of hypocretin, that there is an issue with being able to stay awake. There has also been studies to prove that narcolepsy can be triggered by environmental situations that cause an immune response. Narcolepsy has also been reported in patients with trauma to the hypothalamus. Since narcolepsy is generally connected to a person's hypocretin levels, the main system that is involved is the endocrine system. The endocrine system includes the hypothalamus. The hypothalamus contains 100,000 to 200,000 neurons that produce hypocretin. When combined with cataplexy, which, to reiterate, is the loss of voluntary muscle, both the nervous system and muscular system become involved. So when mentioning the prevalence of narcolepsy does affect approximately 1 to every 2,000 people within the U.S. Narcolepsy occurs anytime between the ages 7 and 50. However, the peak of ages where we see the most cases are around 15 and 36 years old. Narcolepsy with cataplexy affects 0.02% of the adult population worldwide. Some risk factors that could result in narcolepsy include, but are not limited to, familial history, previous medical conditions, and gene mutations. In terms of family history, those who have first-degree relatives with narcolepsy with cataplexy are 40% more likely to develop the condition. The likeliness of narcolepsy occurring also increases after having certain medical conditions, such as upper airway infections, a head injury, a stroke, or a tumor. Another risk factor that could occur is due to a certain gene mutation in the HLA series of gene codes for proteins which are used in the body's immune system. When the antigen protein is altered, it is possible for the immune cells to misidentify the hypocretin producing cells in the brain as a target. Okay, so those who are diagnosed with narcolepsy will experience the condition for the rest of their life. Symptoms may become stable, but as we've seen, many symptoms do generally get worse over time and may require additional medication in order to manage it. So when referencing treatment for narcolepsy, there are standard and alternative methods. Some traditional treatment includes stimulants. Stimulants stimulate the central nervous system. Some examples of these is modafinil and artemether. Another treatment is serotonin reuptake inhibitors. These suppress REM sleep. Some examples of these inhibitors include fluoxetine and venlafaxine. Some other treatment includes tricyclic antidepressants, which are effective against cataplexy. And some of these treatments include protriptyline, anafamine, and chlorpheniramine. And then the last treatment is sodium oxybate, which is highly effective towards cataplexy and also helps to improve nighttime sleep. Some alternative treatments that are available just in case a person that isn't into standard treatment or wants more of a natural treatment includes guarana, which is a natural stimulant, ginkgo biloba, which increases blood flow to the brain, ephedra, which increases energy levels, B-complex vitamins, which are quite important to the sleep-wake cycle. When being diagnosed with a condition, it is important to have certain lifestyle changes so it becomes more manageable. And in terms of narcolepsy, some changes that can be made include eating complex carbohydrates and vegetables, avoiding eating simple carbs and sugars, avoiding eating heavy meals and drinking alcohol, and scheduling short naps throughout the day so you're less likely to be drowsy. Exercise regularly, and to make sure not to operate machines, cars, or any hazardous activities when feeling drowsy. Some other impacts narcolepsy has on people is on their social interactions. A person that is experiencing narcolepsy may struggle to stay awake during social interactions and activities. They may also be confused or grumpy upon awakening. They may need to take naps at what people may deem inconvenient times. They may also have hallucinations during conversations and may experience cataplexy at unexpected times. So the challenges with narcolepsy can be managed by educating family and friends. It's important that the people around you also know the condition and what you're going through so they can have empathy for you. And then also communicating with others for the same reason as above. Maintaining social flexibility and getting involved with narcolepsy support networks. It's important to be surrounded by people who understand what you're going through, understand the condition, and understand you as a whole.